I've just got back from Lebanon, where I was visiting our partners and seeing the programmes that they've been implementing to help the Syrian refugees. I think the first thing I'd like to say a little bit about is the sorts of conditions people are facing. The needs of the people that I met are really quite varied. I mean, some people have only just arrived. There's large numbers of people coming across the border into Lebanon every day, and they need help just finding shelter. A lot of them have fled with nothing, just the clothes that they're standing in. So they're needing food, they're needing assistance with shelter, they're needing blankets, mattresses, etc. Other people, some of them have been around for several months. They've maybe run out of all their savings. Perhaps they've been paying rent somewhere but can no longer afford the rent, so they're having to find alternative accommodation and alternative shelter. Increasingly, there's a lot of people who previously, when they arrived in Lebanon, had not registered as refugees. Perhaps they felt that they had sufficient savings, they didn't need the assistance, but they've now run out and are trying to register in order to be able to get food assistance. I met one family. They're living in just one small room in an area that's a slum area on the outskirts of Beirut. The mother was looking after 5 other children whose mother had died of a heart attack during one of the raids in Syria. She herself was pregnant when she left. She became very ill, and the partner that we're working with helped her to get to hospital and get the medical care that she needed, so that although her baby was born prematurely, thankfully her baby had survived that. And so when I met her, she was cradling her 20-day-old baby in her arms. But I think something that struck me about that was she actually didn't know when her baby had been born. When we asked how old the baby was, she couldn't tell us. I think also what that said to me was the level of trauma that people are experiencing, the psychological impacts of the war and the experiences that they've faced. In Syria, the situation is similarly very, very difficult. We have a partner who is working there, providing mattresses, blankets, medical assistance, hygiene assistance for people. And they tell us about both the difficulties that they have accessing people because of the security situation, but also of the level of destruction that they encounter in the work that they're doing. Christian Aid is also working in Iraq. I think Iraq's a country where we haven't heard so much about in association with the situation in Syria. There are approaching 100,000 refugees in Iraq now. Many people are living in whatever accommodation they can find, some of them in makeshift camps, some of them living in, say, garages, in disused factories, in schools, in all sorts of places that they can. That means that they're quite dispersed, and so I think it's really important that we're able to work with local organisations. They know the communities, they know where people are, and they're much more, they're very well placed to be able to identify what the different needs are of people. There's a lot that our supporters can do to help us respond to the Syria crisis. One of those, and an important one, is to donate. So if you're interested in donating, you can do that by clicking on our website at www.christianaid.org.uk.